First, what is person-centered care? According to the World Health Organization, person-centered care is defined as an approach that embraces the perspectives of individuals, families, and communities. They are seen as a participant and beneficiary of the healthcare system, which humanely and holistically responds to their needs or preferences. The care provided centers on the requirements of the person and not the disease. McCormack and McCants place importance on the individual at the heart of the decision-making process. Person-centered care focuses on respecting a patient's rights and treating them as an individual, building trust and understanding, and developing therapeutic relationships. McCormack and McCants have created a framework in which we can ensure person-centered care is delivered. The prerequisites focus on the attributes of a nurse. These are professional competency, the ability to develop interpersonal skills, commitment to the job, and clarity of one's beliefs and values, knowing self. These are essential building blocks for healthcare professionals. In the context of person-centeredness, professional competency is more than simply demonstrating correct behavior. It encompasses the knowledge, skills, attitudes, and judgment of the practitioner to negotiate care options and deliver holistic care. This knowledge and skill is necessary for a nurse in order to make decisions and prioritize care. Nurses must demonstrate they have an understanding about different ethical concepts and theories, are informed about common ethical issues, codes of ethics, and have a sound understanding of the power dynamics of the social, cultural, political, institutional, and legal environment. Regulatory bodies provide guidelines and regulations to keep a nurse's skills up to date. The Nursing and Midwifery Board of Australia sets standards of education for nurses and has included core competencies that must be met. As nurses, we must be committed to professional development and continue to learn and develop new skills, keeping them up to date. According to the Nursing and Midwifery Board of Australia, professional development aims to enable nurses to maintain, improve, and broaden their professional knowledge, expertise, and competence to meet their obligation to provide ethical, effective, safe, and competent practice. As nurses, it is of great importance to have a positive attitude towards our patients and peers. These attitudes should respect a person's values, beliefs, culture, and rights. Professional competency is a fundamental concept in nursing and helps us to provide holistic care to our patients to obtain better patient outcomes.
Interpersonal skills are effective communication techniques, connecting two or more people and how they interact with one another. Nurses require these skills to provide person-centered care, building mutual trust and understanding, and by helping patients feel safe and respected. These skills also promote professional, effective communication with other team members. A productive interpersonal skill base delivers person-centered care through communication using a variety of styles at different levels. These include verbal communication, non-verbal communication, listening, and responding. Verbal communication includes closed and open questions which facilitate conversation and encourage a flow of information. This is integral to communication during procedures, for example, at bedside handover. Inclusive patient teach-by techniques enhances the human connection phase, which may positively influence patient outcomes. Non-verbal communication transmits messages of power and includes body language, eye contact, facial expression, and posture. Mindfulness is vital to correctly action and perceive non-verbal skills as incongruency. Many difficulties arise when people send mixed messages by expressing one-of-a-kind message verbally and another non-verbally. Active listening is an engaging skill to ensure concerns are taken seriously. A good listener reduces both physical and emotional distress by grasping an understanding of any underlying worries. For example, a patient might convey a resistance to a particular procedure. A nurse identifies such concerns, which alleviates the patient's fears and creates a better experience. Interpersonal skills in nursing must also extend to providing reassurance, empathy, and sympathy by using emotional intelligence. A therapeutic relationship is based on skills that incorporate caring behaviors and cultural safety. Nursing is an interpersonal caring process that acknowledges the uniqueness of each individual.
Commitment to the job. Commitment is a fundamental for a nurse, which indicates a nurse who wants to provide best quality care to the patient. Nurses within a strong commitment often achieve positive outcomes. Commitment to the job can be displayed in a three levels: individual, team, and organizational. There are multiple ways of commitment in individual level. Nurse giving of self by delayed shifts, use on time to complete the work. Going extra mile. For example, there is a case that nurse being gave his own shoes to the homeless patient. Sometimes it's not just about looking after a patient. Instead of focus on patient only, nurse also provide extra emotional support and attention for their family. Besides, nurse also being asked to do the extra shift even double. Nurses demonstrate commitment within a team level because healthcare care workers always deliver the care in a team setting. However, it can be very complex. We need to develop a clear idea within a team setting. Organizational commitment is the key. It's the relationship between the nurse and the whole healthcare setting. It always being considered the best indicator for understanding the behavior of nurse and where they belong.
The person-centered nursing framework identifies clarity of beliefs and values as one of the prerequisites that enable practitioners to work within the care environment. As individuals, we all have different values and beliefs that we develop throughout our values are described as aspects of life we hold in high regard, whereas our beliefs are meanings and fundamental ideas we have about the nature of the world, ourselves, and others. Within nursing, you will encounter many values and beliefs that are different to your own. Respecting a patient's values and beliefs plays a crucial role in forming a trusting relationship. A nurse should always be aware of these different views in order to know how they might affect the patient's initial care plan. This can be done by asking the patient prior and understanding the concepts of culture, racism, and class.
Knowing self. According to McCormack, Brenda, McKen, and Tanya, knowing self is to understand that nurse as a person has own identity, values and beliefs, and worldview, which affects the way the care is being delivered. It is achieved through continuous reflection, self-awareness, and feedback from others. Knowing about oneself is not an easy task. It is a dynamic and transformative process of self-reflection and change. It is to be able to reflect in action while doing something or on action after doing something. It is important to reflect on the experiences and appreciate the positives and learn from weakness. Facilitate self-reflection is one of the techniques of self-awareness. Self-awareness leads to analyze and monitor behavior in a genuine way that enables nurses to create an environment which helps in promoting interpersonal relationship with patients. It is a conscious choice of engaging in intrapersonal self-discovery. Genuine feedback from others like patients' families and friends and colleagues also helps in knowing self. Johari window model is one of the strategies to develop self-awareness. It was developed by Luft and Ingham in 1955. This model has 4 quadrants: open, blind, hidden, and unknown. Open area, known to you and known to others; blind, known to others but unknown to yourself; hidden, known to yourself and unknown to others; unknown to yourself as well as others. Wider the open area is, the more self-aware the person will be. It can be achieved through self-disclosure and feedback from others. Some of the importance of self-awareness are: it helps develop therapeutic relationship with self and other, help become more disciplined and understanding, it improves communication skill, help become resilient and empathetic, it also improves the quality of workplace environment, and help manage difficult nursing situation. Some of the leadership challenges are organization policies and procedure which does not support leadership development skills and training, organization which does not recognize valued work of the employee, excessive paperwork can also challenge leaders to lead in the clinical area, time constraint and workload are another factor which constrain nurse leadership development. The National Safety and Quality in Health Service Standard are an initiative in healthcare which support person-centered care. It is developed by Australian Commission on Safety and Quality in Healthcare. 8 standards listed in the slide embedding person-centered care are prerequisite to ensure quality and safety in nationwide healthcare organization.